Hey guys, it's me, Labandia Mulig, and that in this video, I will be showing you what it looks like as a veterinary nurse. We will be having a new patient for today, and that I will show you the journey on how to take the patient's physical examination, vital signs, and to educate the owner. So now, the first thing I do in the morning is getting ready for work by getting up and get dressed and eat breakfast and get to work. I will be putting on a long sleeve only because I don't have a scrub suit yet, in order to protect my arms from scratches, and that I also make sure to tie my hair in a ponytail so it won't distract me and my patients at work. I then put on my face mask, get my bag, and then head off to work. Once I had entered the clinic, you might be wondering what should you do before and after first meeting the client and patient. Well, I normally start by disinfecting the table and preparing the stations to accommodate the patients. Once I finish disinfecting the table, I then initiate a phone call to remind them of their patient's schedule and appointment for today. Oh, I think we have our first client for today. Good morning, sir.
Good morning.
Go. Go. Good morning to you too. So, what is the reason for your visit for today?
My pet is due to for third dose in 5-in-1 vaccine.
Okay, I see. So, please can you fill up this form for the pet health record and the vital signs chart. So, what is his name?
His name is Benz. His age is 1 year and 2 months.
Oh, so how about his breed?
His breed is Husky.
Okay. Go. So did you bring his pet health card?
Yes, here it is.
Okay. Thank you. So what should we do before we take the patient to the attending veterinarian for his or her vaccination? First, let us prepare the patient by taking his physical examination, vital signs, and also to educate the owner. Do not forget to inform the owner every procedure that you are going to perform on her pet. I will be now taking her physical examination and vital signs. Sir, prior to the vaccination, the vet must undergo physical examination and that she can wait in the waiting room. For the physical examination, we need some gloves to evaluate the animal's overall health. It is important to thoroughly assess your patient by observing the animal before any hands-on exam. See how it acts and how it moves naturally. Furthermore, evaluate the weight and body condition score of the animal. For the first part of the physical examination, the oral cavity. This includes the gums, mouth, teeth, tongue, and throat. Examine for any tartar stain, odor, and broken teeth. Observe the gums as well and take note of the color and capillary refill type. Afterwards, proceed to the head exam, which includes the eyes, the ears, and the nose. Check for pupil reflexes when the light is shined directly into the eye. Moving to the nose, notice any nasal discharges, foreign objects, and swelling. And with the ears, observe if there are any discharges, redness, sores, and odor. Make sure to check the head, face, and neck for any sores, hair loss, areas of swelling, redness, and the wounds. Let's proceed on checking the skin, hair, paw pads, and nails. Check for any signs of hair loss, dandruff, parasites, clumps of hair on the pet's hair coat. As you can see, there is nothing wrong with Vin's skin. That he is all good with his skin. Then check the nails for injury, cracks, or wounds. Furthermore, do not forget to check the hydration status of the pet by gently pull the skin and let go. If it takes too long to reverse and fall back in its place, it's the first sign of dehydration. Moving on, examine also the bones, joints, and muscles. Evaluate the limbs joints by bending each joint for any swelling and pain response. Now let's check the abdominal area, which includes the stomach, intestine, and internal organs. The abdomen should be palpated by running both hands, gently pressing to check for any abnormalities. It is also important to check all lymph nodes to note for swelling and enlargement. Lastly, let's take a look at its urogenital system. This includes the urinary and the genital organs, which in males check the penis, prepuce, and testicles. Take note for any discharges, inflammation, masses, swelling, signs of diarrhea, and odor. Don't forget to check the rectal area for signs of diarrhea, signs of the anal glands, odor, and masses. Now that I'm done taking his physical examination, let us now proceed on getting his vital signs. For this, we will need a stethoscope, a thermometer, some Vaseline, and a glove. Let's check first the temperature of our patient. For more accurate results, the temperature must be taken rectally. Take note that taking the rectal temperature is uncomfortable to the animal, and the ideal that the animal be seated and keep calm during the process. The animal must have a normal temperature when it receives a vaccine. Make sure to disinfect the tip of the thermometer with alcohol and lubricate the tip with a Vaseline. Afterwards, insert 1/4 or 1/2 length of the tip of the thermometer into the rectum and wait for the thermometer to beep. After taking the temperature, make sure to disinfect the tip of the thermometer and keep it in a safe place. Let us now check the pulse and heart rate of the patient. The pulse is commonly found in the femoral artery, which is on the side of the left hind leg located. Place 2 fingers on the artery and check the strength of the pulse. Take note this is the proceed to examining the heart rate. But you can also use the stethoscope in examining the heart rate or the pulse. You will need a stethoscope to listen to the heart. Locate the cardiac area, which is at the point of the elbow, left elbow. Count the number of the heartbeats within 30 seconds and multiply by 2 to get beats per minute. During the pulses, take note for any abnormal heart sounds. The pulse rate and the heart rate must always match. Do not forget to measure the respiration rate by evaluating how many breaths an animal takes in a minute. Lastly, it is important to be able to assess the pain level of the patient. Now that I've finished the physical examination and checked the vitals of the patient, I can say that the patient is now ready to be taken to the attending veterinarian for its vaccination. At this juncture, while waiting for the veterinarian to finish the vaccination, what you should say to the owner, her pet was vaccinated. As a veterinary nurse, it is one of your responsibilities to help educate the owner on how to properly care for their pet.
No.
Which you need to advise the owners to not bathe their pet for a few days, where their bodies will be recovering and bathing can be stressful for them. Furthermore, advise to the owners follow the schedules for their vaccination program. Their pet must remain in quarantine until the animal completes its all boosters. Educate the owners that it's common for their pets to experience mass side effects after the vaccination. It may cause significant discomfort, and it is important to contact the clinic if there are more any serious, less common side effects that can be life-threatening to their pet. After the meeting, make sure to clean or disinfect the table again to accommodate more patients during the day. Disinfecting is one of the practices in the clinic in order to avoid the spreading of illnesses and diseases and bacteria. That was a good patient. During the day, we entertain more patients and to educate more clients. Afterwards, we write down and record every transactions that we keep on track. the world of veterinary medicine is a complex. Therefore, the need of a veterinary nurse is a very important to be a part of a veterinary team. It's one of the most rewarding experience ever. So that wraps up for today's video about a day in the life of a veterinary nurse. And that's all. Thank you so much for watching. To those aspiring veterinarian students, know that you are born to save animals. Laban lang para sa kinabukasan. And that's all. Thank you. Bye.